If you're over 60, there is something you might be doing every single night that can quietly increase your risk of a stroke without pain, without warning, and without any obvious symptoms while you sleep. You go to bed feeling normal, and by morning, something has changed. You wake up confused, your speech feels slow, or one side of your body feels weak. This kind of stroke often happens during sleep, silent, sudden, and life-changing. And what makes this even more frightening is that many of these nighttime strokes are not caused by smoking, bad diet, or lack of exercise, but by common sleeping habits that most seniors believe are completely safe. They're not. In this video, I'm going to walk you through the most dangerous sleep positions and nighttime routines that may be quietly increasing your risk of stroke, blood clots, and dangerous blood pressure spikes, especially during the early morning hours when the brain is most vulnerable. If you or someone you love is over 60, this information could truly protect your future. Let's begin. Mistake number 1, sleeping flat on your back with no pillow. Many older adults sleep completely flat on their backs with no pillow under the head. It feels natural. Some people say it helps their back. Others say it opens their chest and makes breathing easier. But medically speaking, sleeping completely flat can increase stroke risk in seniors. Here's why. As we age, the blood vessels in the neck and brain lose flexibility. They don't drain blood as efficiently as they once did. When your head is at the same level as your heart, gravity cannot help blood drain away from the brain. Blood can begin to pool and slow down in the neck and head. Slow-moving blood is more likely to clot, and those clots often form during the early morning hours when blood pressure naturally rises. This combination, sluggish drainage plus morning pressure surge, is one of the most common triggers for sleep-related strokes in older adults, especially in people with high blood pressure, atrial fibrillation, sleep apnea diabetes, or stiffened arteries. The simple fix is slight head elevation. About 20 to 30 degrees is enough to help gravity assist blood flow, reduce pressure inside the skull, and improve oxygen delivery to the brain. Even one supportive pillow that keeps the neck aligned can significantly reduce risk. This isn't about comfort. It's about circulation to the most delicate organ in your body. Mistake number 2, sleeping face down on your stomach. Sleeping on your stomach may feel comforting, especially if you started doing it years ago. But for seniors, this position can be extremely risky. When you sleep face down, your neck must twist sharply to one side so you can breathe. This twist compresses the vertebral arteries, the vessels that supply blood to the back of the brain, which controls balance coordination, consciousness, and breathing regulation. At the same time, pressure from the pillow and mattress can compress the carotid arteries in the neck. So both blood going into the brain and blood draining out of the brain can become restricted. Oxygen levels may also drop because chest expansion is limited in this position. Low oxygen plus reduced blood flow plus aging arteries, perfect conditions for clot formation during sleep. In younger people, the body may wake up and adjust quickly. In older adults, that protective response is slower and weaker. This is why stomach sleeping is especially dangerous for seniors who snore, have sleep apnea, take sleep medications, or have lung or heart disease. The safer option is sleeping on your side with proper neck alignment or slightly elevated on your back. Comfort should never come at the cost of blood supply to your brain. Mistake number 3, sleeping with heavy covers over your head. This habit feels harmless, even cozy, pulling the blanket over your head to block light, noise, or cold air. But medically, this can quietly reduce oxygen levels while you sleep. When your head is under heavy bedding, fresh oxygen is limited. Carbon dioxide builds up around your face. Breathing becomes less efficient. Your blood becomes slightly thicker. Your heart works harder. And oxygen delivery to the brain decreases. For aging brains, even mild oxygen drops can increase clot risk and damage small blood vessels. Over hours of sleep, this creates dangerous stress on already fragile circulation. Many people who suffer silent nighttime strokes never wake up feeling pain, only confusion, weakness, or speech difficulty in the morning. If you need darkness or quiet, use a sleep mask, earplugs, white noise. Keep bedding below the shoulders so your breathing air remains fresh and unrestricted. Warmth should never replace oxygen. In the next part, we're going to talk about something millions of seniors do because of joint pain or comfort and sleeping in chairs and on certain sides, and why these positions may quietly cut off circulation for hours at a time. And what I'm about to explain next is one of the most overlooked stroke triggers in older adults. Now let's talk about sleeping positions that many seniors choose because of pain, comfort, or habit, without realizing how much they can affect blood flow to the brain. These are not rare situations. They happen in millions of homes every single night, and they quietly increase stroke risk during sleep. Mistake number 4, sleeping upright in a recliner. For many older adults, sleeping in a recliner feels like the only way to rest without pain. Back pain, hip problems, shortness of breath, acid reflux. So the bed gets replaced by a chair. But medically, long-term recliner sleeping can increase stroke risk. Here's what happens. When you sleep in a semi-upright position, gravity pulls blood downward into your legs and pelvis. At the same time, veins in the hips and thighs become compressed. This slows the return of blood to the heart and brain. Slow blood is more likely to clot, and those clots often form quietly in the legs or pelvis during the night, then travel upward in the early morning hours when blood pressure rises. In seniors, this risk is higher because blood is thicker from mild dehydration, vessels are narrower. The heart pumps less efficiently. Sleeping upright also weakens the body's natural blood pressure control reflex, causing pressure instability overnight. That instability can trigger small strokes deep inside the brain, called lacunar strokes, often without major warning signs. If you must sleep elevated, a wedge pillow in bed or an adjustable bed is much safer than a recliner because it supports the body evenly and doesn't compress circulation in the legs. Recliners may feel comfortable, but they were never designed for full night's sleep. Mistake number 5, sleeping on your right side with your arm under the pillow. This is one of the most common sleeping positions in older adults. Right side, head on pillow, arm tucked underneath. It feels supportive. But medically, it can restrict blood flow for hours. When your arm is under your head or body, pressure builds on the shoulder, the neck, and the major blood vessels feeding the brain. The carotid artery and subclavian vessels can become compressed. This slows circulation and increases blood pooling in the neck. Over time, pooled blood becomes thicker and more likely to clot. Then in the early morning hours, when blood pressure naturally rises, that clot can break loose and travel directly into the brain. This position also compresses nerve bundles in the shoulder, which can disrupt sleep cycles and increase nighttime movement, another risk factor for unstable circulation. For seniors, the safest side sleeping position is usually the left side, with neck-aligned arms resting forward, not underneath the body, a pillow supporting between the knees. This reduces vessel compression and improves heart and brain circulation. Comfort should never block blood flow. Mistake number 6, constant tossing and turning all night. Many older adults think restless sleep is just part of aging. Joint pain, bathroom trips, light sleep? But frequent tossing and turning may be more than discomfort. It can be a warning sign of unstable brain circulation. Every sharp movement in bed temporarily changes blood flow to the head and neck. In younger bodies, this doesn't matter much. But in seniors with stiff arteries and fragile blood vessels, repeated shifts can cause brief drops in brain oxygen pressure fluctuations, vessel irritation. Over time, this instability increases clot risk. But here's what's even more concerning. Restlessness itself may be the brain signaling distress. Poor oxygen, poor blood flow, blood pressure instability. The body keeps shifting in an unconscious attempt to restore balance. And this fragmented sleep also prevents normal nighttime blood pressure dipping, keeps stress hormones elevated, disrupts the brain's waste removal system. All of these are linked to higher stroke risk and faster cognitive decline. If you or your partner notice constant movement, waking exhausted, morning headaches, dizziness upon waking, these are not normal signs of aging. They are signals to discuss sleep health with your doctor and consider a sleep study. Better pillows, hydration, breathing routines, and consistent sleep schedules can dramatically improve nighttime circulation. In the final part, we're going to cover some of the most dangerous and misunderstood triggers, things that happen before you even fall asleep. Skipping heart or blood pressure medication, sleeping in cold rooms with poor neck support, going to bed right after heavy meals or alcohol. These are some of the strongest predictors of nighttime stroke in seniors. Now we're going to talk about risks that don't come from how you lie in bed, but from what happens before your head ever touches the pillow. These are habits many seniors don't even think about, yet they can strongly affect brain circulation during sleep. Mistake number 7, skipping evening heart or blood pressure medication. Many people take their medication faithfully until one night they forget. Maybe you fell asleep early. Maybe the bottle was empty. Maybe you felt fine and thought missing one dose wouldn't matter. But for older adults, missing nighttime medication can change what happens inside your blood vessels while you sleep. Blood pressure naturally rises in the early morning hours. That's when many strokes occur. If medication isn't present to stabilize pressure and heart rhythm, vessels experience more stress, and blood can become more likely to clot. This is especially important for anyone who takes blood pressure medication, heart rhythm, medication, blood thinners, or low-dose aspirin. Consistency matters more than perfection. Simple tools help. Pill organizers, phone reminders, keeping medication near the bedside. Not because something bad is expected, but because stability protects the brain. Mistake number 8, sleeping in cold rooms with poor neck support. Many people believe cooler rooms always mean better sleep, and some cool air is helpful. But very cold rooms combined with poor pillow support can quietly restrict blood flow to the brain. Cold temperatures cause blood vessels to tighten. When that happens in the neck and where major arteries carry blood to the brain, circulation can slow. Now add a pillow that bends the neck forward or twists it sideways. That further narrows already sensitive vessels. Over hours, reduced flow and pooling blood increase clot risk. This matters even more for seniors because arteries are less flexible. Neck spine changes are common. Oxygen delivery is more sensitive to posture. A safer approach. Room temperature around 65-68 degrees, 18-20 C. Medium firm pillow keeping head aligned with spine. Avoid chin. Tilting toward chest sleep posture and temperature work together. Support matters just as much as comfort. Mistake number 9, going to bed right after heavy meals or alcohol. This one surprises many people. Late dinners and evening drinks are common routines. But after 60, digestion and circulation compete for resources. When you eat a heavy meal, blood shifts toward the stomach. Less blood reaches the brain, digestion continues for hours. Now add alcohol. Alcohol first relaxes blood vessels, then later causes rebound tightening. It can also disturb heart rhythm and lower oxygen during sleep. Together, late meals and alcohol can create unstable blood pressure, dehydration, slower brain circulation, all during the exact hours when stroke risk is highest. A safer routine. Finish large meals at least 2 to 3 hours before bed. Drink water with dinner if you drink alcohol earlier in the evening and in small amounts. Sleep should support circulation, not compete with digestion. What safe sleep looks like. After 60. Let's bring this together into a simple, realistic plan. Safe sleep is not about perfection. It's about giving your brain steady blood flow every night. Here's what truly helps. Slight head elevation. Preferably left side sleeping, neck aligned, not bent forward, arms resting freely, not under the body. Comfortable room temperature, not cold, consistent medication routines. Light evening meals, gentle hydration before bed. These are not dramatic changes, but they protect memory balance, speech independence. Sleep is not only rest. Sleep is when your brain repairs blood vessels, clears waste, and stabilizes pressure. When sleep is supported, the brain is protected. Final thoughts. Growing older doesn't mean losing control over your health. It means small choices matter more. The way you sleep, the way you prepare for sleep, the habits you repeat every night, they all shape how your brain functions the next morning. Nothing here is about fear. It's about awareness and using what you now know to support yourself. You deserve nights that restore you, not strain you. And simple adjustments can protect your comfort, confidence, and independence for years to come. If this video helped you, consider sharing it with someone you care about. Sometimes the smallest changes bring the greatest protection. Thank you for watching, and I'll see you in the next video.